Do you recognize this rhythm and know what action to take? Now you can learn at your own pace, on your own schedule, and use your increased clinical knowledge to complete this continuing education activity or prepare for the ACLS course. Welcome to the American Heart Association's Learn Rhythm Adult, an official online AHA rhythm recognition course. The Learn Rhythm Adult program teaches all you need to know about rhythm recognition within the standard Lead 2 monitoring system aimed at treating adults with arrhythmia. The program consists of 4 parts. Part 1, the cardiac cycle, which introduces a basic understanding of rhythms and shows you how the ECG strip depicts cardiac impulses. Part 2, arrhythmias, which focuses on teaching the most common arrhythmias encountered in clinical practice. Part 3, a rhythm summary, where you can learn and train a systematic and fast way to identify rhythms and arrhythmias. And finally, Part 4, the AHA completion examination. Successful completion of this exam qualifies you for the Learn Rhythm Adult certificate. The program uses narration, drawings, animated graphics, and interactive activities to explain the rhythm recognition lessons. In addition, throughout the course, various self-assessment sections will help you practice along the way. In the completion exam, you'll be tested with a series of real cardiac rhythm strips that you should be able to identify. The exam has 2 parts. Part 1 is multiple choice and will test your knowledge of basic anatomy, physiology, and monitoring techniques. Part 2 tests rhythm recognition. You are allowed 3 attempts to achieve the required score of 84%. Thank you for your interest in Learn Rhythm Adult.
The cardiac axis is the overall direction of ventricular depolarization. Sometimes the axis is normal, too far to the left, or too far to the right. You can work it out really simply by finding leads 1 and 2 and deciding if these leads are positive or negative. Use your thumbs. Put a thumb up for a positive lead or down for a negative. If leads 1 and 2 are both positive, that's 2 thumbs up and the axis is normal. If lead 1 is positive but lead 2 is negative, your thumbs have left each other and that's left axis deviation. If lead 1 is negative and lead 2 is positive, your thumbs are heading right for each other and that's right axis deviation. Let's try that again. In this ECG, there's 2 thumbs up, so the axis is normal. In this ECG, thumbs have left each other, so it's left axis deviation. And finally, in this ECG, thumbs are headed right for each other, so it's right axis deviation.